Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering maternity, but to be more specific, I'm going to be going over eclampsia. Before we get started, as always, I'm going to ask you to please support me, support this channel by liking this video and subscribing to my channel if you haven't done so already. Don't forget I have audio lessons available on my website, nexusnursinginstitute.com. Okay guys, so let's get started. Eclampsia, take a look. So eclampsia, it's usually preceded by premonitory signs and symptoms, including, you guys need to know this. What are those signs and symptoms we see before that patient goes into eclampsia? Persistent headache, blurred vision, photophobia, severe epigastric or right upper quadrant abdominal pain, and altered mental status. Remember, this is the patient. You need to be checking their blood pressure routinely. Immediate care. Nursing actions during a seizure are directed towards ensuring a patient airway and patient safety. So let's talk about this, guys. There's preeclampsia and eclampsia. Preeclampsia is before that patient goes into eclampsia. We're praying that patient does it, but preeclampsia, that patient's blood pressure is very high, and we're going to be having that patient on seizure precautions because what we don't want to happen is for that patient to go into seizures. Okay? So when that patient goes into eclampsia, they left preeclampsia, they are now in eclampsia, that means seizures. So number one for this patient is going to be safety. Take a look. The nurse should call for help, but remain at the bedside. You do not turn your back on that patient and go get help. You are going to stay with that patient and scream at the top of your lungs for help. Side rails on the bed must be raised and should be padded with a folded blanket or pillow if possible, because we don't want injury to the head. Immediately after the seizure, the nurse should lower the head of the bed and turn the client to the side, preferably the left side, guys. This helps prevent aspiration of vomitus. Don't forget all the things that you have to do during a seizure. That patient has a seizure, you're staying with them, you're screaming at the top of their lungs for help, and you're making sure they don't have any restrictive clothing on them, which if that patient has preeclampsia, we're already going to make sure they don't have anything restrictive on them, because we already know they are at risk for having seizures. Right? You're going to look at the time real quick to see what time that seizure started. You're going to watch your patient, make sure they're safe, but you're going to look to see what type of seizure that patient has, because you're going to have to explain that to the healthcare provider, because everything else is ordered for that patient. Most of it is going to be based on your observations and what you report. Let's keep going. Nursing actions after a seizure are directed towards maternal stabilization. First, the status of the woman's airway, breathing, and pulse should be assessed. You see who comes first, guys? Mom. The nurse should suction secretions from the glottis to clear the airway. Remember, we want to prevent aspiration. So we're going to clear secretions from the glottis, insert an oral airway, and administer oxygen at 10 liters per minute by face mask. If an IV infusion is not in place, one should be started with an 18-gauge needle. If an IV line was in place for seizure, it may be infiltrated and will need to be restarted immediately. As soon as IV access is obtained, that patient is going to get magnesium sulfate. Remember what magnesium sulfate does? It relaxes everything, because we don't want mom going back and having another seizure. If eclampsia develops after initiating magnesium sulfate therapy, additional magnesium sulfate should be administered. Now, let me talk to you guys about magnesium sulfate for a minute, because I don't want you to confuse it. Magnesium sulfate, it relaxes, brings everything down. And one of the great side effects, I should say, one of the effects that it does is that it also brings down the blood pressure. Because remember, mom with preeclampsia, that's the biggest problem. Blood pressure is so high, right? She's at risk for going into seizures. However, we do not ever give magnesium sulfate for the simple reason of bringing down the blood pressure. Magnesium sulfate, the hypertension, that's not an indication for magnesium sulfate. There are much better and safer drugs on the market to bring down the blood pressure. If we're giving the magnesium sulfate, guys, it's to prevent a reoccurrence of the seizure, not for the hypertension. Now, yes, that magnesium sulfate is going to bring down the blood pressure, which is great. This is something that we want to happen, absolutely, but that's not an indication. And as a student, you guys need to understand that. All right, let's keep going. Magnesium sulfate is the drug of choice. Ding, ding, ding. Whenever you see drug of choice, highlight it, underline it, put a star next to it. It's important. Magnesium sulfate is the drug of choice for treating eclamptic seizures and preventing repeated seizures. That's what we're going to give. It reduces the risk for aspiration because it does not depress the gag reflex. After the woman stabilized, uterine activity, cervical status, and fetal status must be assessed. But we're always going to assess who first? Mom. Look at the safety alert. Immediately after seizure, a woman may be very confused and combative. Restraints may be necessary temporarily. Several hours may be needed for the woman to regain her usual level of mental functioning. She's going to be very confused and very tired. Allow her to rest. Let's go over emergency treatment. You guys need to know this. So, like I said, we're talking about eclampsia, but it's important that you guys understand preeclampsia because it's in preeclampsia that we're trying to prevent that patient to go into eclampsia and going into seizures. Like I'll do a video on preeclampsia for you. But anyway, let's go over the emergency treatment. Tonic-clonic convulsion. So now a mom who had preeclampsia, now she's having seizures. Pause to read. I'm not going to go over all of this, but I want to bring this to your attention. State of convulsion. The muscles relax and contract. Alternatively, that's their clonic. Respirations halted and then begin again with long, deep sternness, inhalation, coma ensues. She's not going to remember anything that happened during that seizure. Nursing intervention. Number one, keep airway patent. We need to keep that patient breathing. Turn head to the side. We don't want her to choke or gag on her own, maybe vomitus or mucus, right? Or saliva. So we're going to turn the head to the side, place pillow under one shoulder or back if possible. And preferably you could put that pillow under their right side so we can kind of have them more towards the left side. We're going to call for help, but we're going to do it where? At the bedside. We are not leaving our patient. Side rails have to be up, bed in lowest position, and the side rails need to be padded. Observe and record convulsion activity. Why? Because what you report, most of what's going to be ordered for the patient afterwards is going to be based on what you report. After the convulsion, do not leave the patient unattended until they're fully alert. You're going to give them oxygen via non-rebreather face mask at 10 liters per minute. You're going to start IV fluids, monitor for potential fluid overload. Give magnesium sulfate or other anticonvulsant drugs as ordered. And when it comes to eclampsia, 99% of the time, it's going to be your mag sulfate. You're going to monitor blood pressure, pulse, respirations frequently. Provide hygiene and a quiet environment. You want to decrease stimuli for that patient. You're going to make sure that you dim the lights. You're going to make sure there's not any noise in the hallway or in the room where the patient is. You're going to provide privacy for the patient. Make sure that you close the curtain. The rest of these are just as important, guys. I'm just not going to go over all of them with you. Just pause to read. But these are very important nursing interventions for you to know about the eclampsia patient. I will be making a preeclampsia video for you. Preeclampsia is so heavy. It's going to be a multi-part series, but it's coming soon. However, this was the eclampsia portion for this video. Most important things you need to know for testing purposes are right here. Watch it twice if you have to, but this is very important information. Guys, thank you so much for watching this video, and you guys catch me on the next video.